Hi, we're going to talk about pulmonary emboli now. Okay, so why is pulmonary emboli important to know about? Well, if you look from this slide, you see what happens. It's pretty bad things occur when a pulmonary emboli happens. Main thing that occurs, you've got the constriction because the clot flows into the lungs. But what you have is a ventilation perfusion imbalance. You end up with right ventricular failure and the patient develops shock. So it really becomes a very major event, critical event for the patient. So who is at risk to develop pulmonary emboli? Anybody with immobility, venous stasis, history of hypercoagulability, heart disease, trauma, post-op, postpartum, someone who's diabetic, someone who's using oral contraceptives, they have an increased risk, and someone that has past history of thrombophlebitis as well. So how do we prevent it? Well, think about it. Anticoagulation therapy. Think about how many patients you've taken care of that are on Lovenox. How many patients have you taken care of that are on SCDs, sequential compression devices? How many people have you ambulated frequently after they've had surgery to prevent the development of a clot? Okay? Because remember, if they develop that DVT, it could decide to shoot its way right to the lungs. Okay? So we definitely that's how we're going to prevent things. You're going to do exercises. If they can't get out of bed, they're going to do those leg pumping exercises. We're going to definitely anticoagulate them. Now, if you have a patient, say, that develops chronic blood clots, frequently, and usually sometimes these are people that have diseases that cause that hypercoagulability, they would most likely have surgery and where they put in an umbrella filter into the inferior vena cava. And what that does is, you can see here, see here where it's placed, and it is an umbrella, just an umbrella. And what it does, was those clots come up, it catches them. So it prevents it from coming up further and getting into the lungs. Okay? So that's what an umbrella filter is. It's pretty simple procedure. No procedure is simple, but it's pretty simple when it's placed in. Okay, so let's answer this question. Is this a true or false statement? Bradypnea is the most common sign for possible pulmonary embolism. And that would be false. Tachypnea is, okay? So let's look at this little guy. He seems to be having some trouble. He's got a pulmonary emboli, okay? So what are we going to do for him? We're going to put him on thrombolytic therapy. And that's going to be in the form of IV heparin. Okay, so you got that here. Whoops, sorry guys. Go back one slide. All right, so what you've got here is you've got your IV heparin, piggybacked into your normal saline, okay? Remember, with heparin, you're going to monitor labs, and you're going to be checking for their PTT, okay? Now remember, as patient improves and we're weaning them off the heparin, say, this person's going to need Coumadin as well. So when we add the Coumadin to the therapy regime, we'll be tapering down the IV heparin, waiting for the Coumadin levels to get therapeutic. And what lab are we going to monitor for that? That's going to be your INR. We're going to monitor the INR for therapeutic levels. Once it reaches that therapeutic level, they're going to discontinue that IV heparin. Okay? Symptoms that the patient may present with when they have a pulmonary embolism: sudden sharp chest pain, tachypnea, hypoxia, shortness of breath, tachycardia, may cough up blood, possibly, okay? Remember, this is sudden onset. I've had some patients complain or feel like impending doom when this occurs. Take away important things to remember: how to prevent it, so hopefully you never have to deal with this in your patient. The other thing is, remember what labs to monitor when they're on heparin and when we start the Coumadin. Remember, Coumadin is always INR, okay? Know signs and symptoms, and know who's at risk to develop it. All right? Okay, that's pulmonary emboli. Short and sweet.